every week I have one or several situations like this. A patient visits me for the first time, and when I ask what procedures she has had done and for what purpose, I just want to throw my hands up in disbelief. In this video, I will list as many as 10 procedures that I keep hearing are being performed, but I strongly advise against doing them. The first procedure you shouldn't do is carboxytherapy for dark circles under the eyes. For those hearing this name for the first time, let me quickly explain. Carboxytherapy is a procedure using a device that injects carbon dioxide into the skin. The procedure promises to improve the functioning of blood vessels and reduce fat deposits. So why do I advise against it for dark circles under the eyes? Because this procedure doesn't stand a chance of actually helping with this problem. Dark circles under the eyes can have several causes. For example, thin skin that allows the color of blood vessels to show through, as well as the loss of subcutaneous tissue, known as the tear trough. However, in no case will carboxytherapy, whether performed once or multiple times, solve the problem of dark circles under the eyes. It is said that carboxytherapy can firm the skin and stimulate the production of elastin and collagen. However, the truth is that there are many much better stimulating treatments for the skin under the eyes. I talk about them in this video. Save it for later. The second procedure you shouldn't do is mesotherapy for the jowls. I've often heard from patients that they had mesotherapy done on their jowls, and every time it just made me feel sad. Mesotherapy simply cannot work for this issue. It's a waste of money and unnecessary discomfort for the patient. Jowls is a colloquial term for loose skin at the bottom of the face, especially around the jawline. Excess skin in the lower third of the face is caused by two factors. First, as we age, we lose subcutaneous fat tissue, which flattens the cheeks and causes the skin to lose its support and foundation. As a result, the skin sags downward and accumulates in the jowl area. Secondly, the older we get, the thinner our skin becomes and the more it loses its firmness. And now, pay attention. Mesotherapy will not help with lost subcutaneous tissue, nor will it improve firmness. Mesotherapy products do not remain in the body permanently, so they cannot replace subcutaneous fat tissue. And what about firmness? Unfortunately, mesotherapy is too weak of a procedure to significantly improve skin firmness or reduce jowls. So what actually has a chance to work? If the cause of jowls is the loss of subcutaneous tissue, it can be replenished with more long-lasting substances, such as hyaluronic acid or your own fat. However, if jowls are caused by loose and less firm skin, then strong tissue stimulators should be considered, such as polylactic acid, polycaprolactone, calcium hydroxyapatite, lifting threads, and finally, surgical lifting. And performing a mesotherapy treatment for this problem simply doesn't make sense. The third procedure you shouldn't do is hyaluronic acid for wrinkles. If you watch my videos regularly, after hearing the last sentence, I'm sure you were surprised and asked, Monica, what do you mean? Hyaluronic acid doesn't help with wrinkles? The point is that hyaluronic acid fills grooves and tissue deficits, but it doesn't work directly on wrinkles. The best example is when we imagine smoker's lines, those wrinkles around the mouth that appear when we purse our lips. Smoker's lines are expression wrinkles, meaning they are caused by the activity of facial muscles, in this case the orbicularis oris muscle. The movement of this muscle causes the skin to fold repeatedly in the same spot, creating wrinkles that are visible even when we're not pursing our lips. What's characteristic for this area is a lot of fine wrinkles radiating out from the lips in all directions, but mainly above the upper lip. And now pay attention. If we inject hyaluronic acid, that is a filler, into the skin, it won't be 100% effective. The injected product will sort of push the skin out and make the wrinkles less visible. That's true. However, many times patients visiting me for the first time in my office were surprised that hyaluronic acid for smoker's lines didn't completely remove the wrinkles, but only reduced them a little. It's important to know that hyaluronic acid doesn't work on wrinkles the way an eraser can remove pencil marks. Fillers add volume and, as the name suggests, fill the tissues. However, improper use can result in having hyaluronic acid in the tissues, but the wrinkles are still there and the patient is not satisfied with the outcome. The fourth procedure you shouldn't do is using a laser for drooping eyelids. I have recorded a special video in which I precisely explain what to do about drooping eyelids, so this point will be very specific. Many of us struggle with the problem of drooping eyelids. That's why the aesthetic medicine industry offers many different procedures that are supposed to help with this issue. One of these procedures is laser treatment, which is supposed to stimulate the skin to produce collagen and firm up the eyelid, thereby making it less droopy. However, if you have drooping eyelids, avoid this procedure and simply don't do it, because you'll most likely be disappointed. Why? The point is that when it comes to drooping eyelids, the benefits of collagen stimulation in that area are too small to actually make a difference. A lot of skin accumulates in the eyelid area, and most often we need a significant change there, which such a laser simply cannot provide. And what will actually make a difference and what is worth doing? The only reasonable procedure for drooping eyelids is surgical lifting, known as blepharoplasty. Such eyelid surgery provides visible and lasting results, and there are no alternatives like stimulating lasers. I invite you to watch the video about drooping eyelids, where I explain in detail all the mechanisms that lead to the conclusions mentioned here. The fifth procedure you shouldn't do is injecting polylactic acid under the eyes. Polylactic acid is the strongest tissue stimulator which forces the skin to naturally produce collagen. It's an excellent product that I have been successfully using with my patients for years, but never under the eyes. Unfortunately, in recent years, this product has also gained popularity for use under the eyes to stimulate the skin. However, the problem is that injecting this product in that area carries a high risk of complications in the form of lumps. Polylactic acid, which I use in my practice, has a strict prohibition against use under the eyes, and it has always been that way. However, there are also other products on the market that did not have such a precise prohibition, and this led to complications in patients. During my training in South Korea, I personally heard about and saw such complications because polylactic acid is also popular there, and it did not look good, especially because the lumps caused by polylactic acid cannot be dissolved. This year, news spread across Poland that the Office for Registration of Medicinal Products, Medical Devices and Biocidal Products issued a safety note specifically regarding one of the polylactic acid preparations in relation to its use under the eyes. The information indicates that the product can cause lumps and should not be used in this area. Even before this note was issued, I warned that despite the popularity of this procedure, I do not recommend performing it under the eyes. If you want to learn more about polylactic acid, I invite you to watch this video. The sixth procedure you shouldn't do is hyaluronic acid for loose skin. In the third point of this video, I told you that hyaluronic acid and fillers in general do not simply remove wrinkles, but rather fill in volume loss in the tissues. That's why it's important not to use hyaluronic acid treatments to firm the skin, because this procedure won't achieve that. If your skin is loose, thin and sagging, injecting 1 or several milliliters of filler won't change that. Hyaluronic acid is useful where the skin has lost its support structure, for example in the cheeks or temples, and as a result, lacking an anchor point, has sagged toward the jowls and the lower part of the face. However, if our subcutaneous tissue is in good condition, which is entirely possible, but the skin is not what it used to be, we need to be very careful with hyaluronic acid. Fillers are not a procedure where you just do it and see what happens. Quite the opposite. We need to plan procedures in such a way that we know what the face will look like in a few or even several years from now. If the skin is loose and that's the main problem, then we don't use hyaluronic acid. So what do we do in that case? There are two options, either surgical lifting or stimulation. A surgical lift will remove the excess sagging skin and restore the proper proportions of the face. If a lift is recommended, it may be the best and most long-lasting option for the patient. The second option is tissue stimulators, which will firm and thicken the skin, something hyaluronic acid does not provide. Tissue stimulators are suitable where the skin is not yet very saggy, as well as in cases where the patient does not feel comfortable with surgical intervention, which should also be respected. The seventh procedure to avoid is lip augmentation, when there is a long philtrum. When I scroll through Instagram, I get the impression that lip augmentation is the best solution for every occasion. Every woman would benefit from it, and each of us should have this procedure done here and now, today. However, that's not true. The best example is lip augmentation in the case of a long philtrum, which I see regularly and which is not recommended in this situation. But let's start from the beginning. The philtrum is the area between the lips and the nose. Since each of us is different, some people have a longer space there, while others have a shorter one. The problem is that the facial anatomy in this area is rarely taken into account when deciding on a lip augmentation procedure. If the philtrum is too long, adding volume to the lips will disrupt the proportions of the face. And to put it simply, it will just look strange. Remember that increasing the volume of the lips will make the philtrum even less visible. This, in turn, will create a strange impression that the patient's lips stick out from the surrounding area, and smiling will only intensify this effect. Overall, it will just look artificial and won't match the rest of the face. So what is the alternative to lip augmentation for people who have such a long philtrum? This is a surgical procedure, the so-called lip lift. Thanks to this procedure, without injecting hyaluronic acid, the doctor shortens the philtrum, but more importantly, it causes the upper lip to curl outward more, making the lips appear fuller. A lip lift is a very interesting and worthwhile procedure to consider in such a situation, while classic lip augmentation is a bit less so. The 8th procedure you shouldn't do is Botox for crow's feet, if the patient is prone to swelling. Botulinum toxin treatments are currently very popular, and patients are approaching them with increasing ease. However, you can also mess up a lot with Botox, and the example of Botox for crow's feet is unfortunately a very common one. So what exactly is the issue? The main role of botulinum toxin is to reduce the activity of facial muscles where it is injected. In other words, the goal is for the muscles not to crease the skin so much and not to cause wrinkles. A particularly interesting area is around the eye, known as crow's feet. These are wrinkles radiating from the outer corner of the eye. Botox for crow's feet gives great results, but performing it on someone prone to lymphatic swelling is a categorical mistake. Lymphatic swelling occurs because lymph is not effectively and efficiently drained by the body. This results in little pouches under the eyes which are accumulations of lymph, especially noticeable, for example, in the morning after waking up. Unlike blood, lymph does not have its own pump like the heart. So the proper functioning of the muscles is responsible for transporting lymph. And now, if we weaken these muscles in a person who already has a noticeable problem with swelling, we will only make the situation worse. Just to be clear, if the patient does not have problems with swelling, then performing a botulinum toxin treatment for crow's feet can be a great idea and bring the patient only satisfaction with the results. However, if the doctor does not recognize the problem of swelling and performs the procedure, the swelling will worsen to the point that mimic wrinkles will become the least of all problems. The 9th procedure you shouldn't do is hyaluronic acid for dark circles under the eyes. Nowadays, it is often said that hyaluronic acid under the eyes is a very bad idea. That's partly true and partly not. There are two main problems when hyaluronic acid under the eyes is a bad procedure. First, when it is done for dark circles under the eyes. Dark circles under the eyes most often result from thin skin, which causes blood vessels to show through and gives the area under the eyes a bluish-purple appearance in the patient. If this is the reason, injecting hyaluronic acid to fill this area will not only fail to help, but will actually do harm by causing visible bags under the eyes. Hyaluronic acid under the eyes only makes sense if there has been a loss of subcutaneous fat tissue, that is, when the so-called tear trough has appeared under the eyes. This is tricky because the tear trough itself can create the effect of dark circles under the eyes, but with a different cause. That's why patient qualification and the doctor's experience before the procedure play a key role here. The second issue concerning the hyaluronic acid procedure under the eyes is improper execution of the treatment. Skillfully injecting filler under the eyes is not necessarily an easy task, and unfortunately, I often see that the acid is injected, for example, too superficially. As a result, it shows through and creates the impression of a bag under the eye and a bluish tint to the skin. So we blame the product for the problems, when in fact the product is perfectly fine, but the procedure itself was not performed correctly. There is also the possibility of so-called overcorrection with hyaluronic acid under the eyes. And that's another pitfall we can encounter with this procedure. What does that mean? Overcorrection is when the tear trough is filled completely flat, to zero, and that's a mistake. First of all, because a total lack of a tear trough is unnatural, nobody has that. And secondly, it's a mistake because hyaluronic acid can attract water, and if there's a lot of it in the tissues right after the procedure, then a few months later, together with the drawn-in water, it can push the tissues out and cause visible swelling. The 10th procedure you shouldn't do is filling the cheeks, when what actually needs to be filled are the nasolabial folds. Do you remember those photos of celebrities who have disproportionately puffed up and large cheeks compared to the rest of their face? It's relatively easy to end up in such a situation if you try to solve every problem with tissue loss on the face by contouring the cheeks. Let me explain what I mean. For several years now, it's often been said that if, for example, we have nasolabial folds, we shouldn't inject hyaluronic acid directly into those folds because the root of the problem lies elsewhere, namely in the upper part of the face. And if we add hyaluronic acid in the area of the cheeks and cheekbones, the tissues will lift and the nasolabial folds in the lower part of the face will become less pronounced. However, if hyaluronic acid were injected directly into the nasolabial folds, the face would be pushed forward, resulting in an unnatural effect known as the so-called monkey muzzle. And all of this is absolutely true. However, nothing is ever black and white. In the same way, it's not black and white that injecting filler into the upper part of the face is always a great idea, and that nasolabial folds should never be filled. The truth is that you always have to look at the patient's situation globally, holistically. This means that aesthetic procedures are not done by following a template, and we have to carefully analyze every square centimeter of the patient's skin before we even think about inserting a needle into it. Unfortunately, I have often consulted with patients who had heavily filled cheeks, overfilled cheeks, and the upper third of the face, but in reality, hyaluronic acid should primarily be used, among other areas, on the nasolabial folds. Then the effect would be 100% natural, and in addition, better results would be achieved using a smaller amount of acid. Because that's exactly the point, to achieve maximum results with the smallest possible amount of filler used. Therefore, if the doctor suggests hyaluronic acid for the nasolabial folds during your appointment, it doesn't necessarily have to be a bad idea, contrary to current trends. Dear ones, in reality, all these procedures that aren't worth doing can be summed up with one simple conclusion. To achieve only good results from aesthetic medicine, you need a doctor who is excellent at what they do. In this video, I didn't talk much about the fact that it's really a good doctor who will help you avoid all the mishaps I mentioned in this video. But don't worry. I've recorded a separate video where I explain step by step how to find a good aesthetic medicine doctor for yourself. Spoiler alert? You can do much more than just check reviews on popular doctor rating sites. So right now, make sure to click on the video thumbnail that's appearing on your screen and keep watching. Thank you for today's video and see you in the next one.